of the most common plaguing problems in the foot is a painful little toe. So let's go into where people have pain in the little toe. First of all, it can be on the outside of the toe, over here, or it can be over on the other side, between your baby or fifth toe and the fourth toe. Both of these are very common. What do you see? How can you tell what's going on? Well, the most common thing you could see is a corn. It's just a thickening of the skin in the area where there is irritation, likely from the outside of the shoe. This can equally as well happen between the fifth toe and the fourth toe. At first you may see very little, maybe a little redness, sometimes a corn, maybe it's white, but it's painful. And it will be made worse by shoes that aren't round like this one and instead press across. This doesn't mean you're wearing tight pointed shoes, but if you've got pain on that fifth toe, the first thing to do is take the shoe off, wear an open sandal, and see if you're more comfortable on either the outside or the inside of the toe, wherever the point of pain is, without that pressure on the toe. This brings up the treatment for that first thing, which is change the shoes and see if you can determine which shoes are bothering you. Maybe it's only the hiking shoe, or the walking shoe, or the dress shoe. Anything with more of a heel in the shoe will add to more pressure in the front by the toes. In the second stage of this problem, you get a real corn, a thickening of skin. That's all that is. Response to bone and pressure, skin helps out, it's not a big help, makes a corn. And it can happen between the fifth and fourth toes. No, they're not usually a wart, they're usually a corn, a painful thickening of skin. So what do we do for the corns? First, keep pressure off it. On the outside of the toe, best thing again, wear shoes that are spaced better, stretch the shoes, or wear a pad over the toe with a hole in it to take pressure off the bone. They also make pads for in between the toes. Sometimes these are a stick-on pad. There are other gel cushions to separate the fourth and fifth toes to avoid that pressure. If it gets past this, then you want to come in so that we can get an x-ray, because what we may see is enlargement of the bone here, or the toe going over further, as you see here with the red bone, where it starts to shift over even more toward the fourth toe. What do we do about those things? Well, the easiest one to treat is the corn between the toes. It actually takes a fairly minimal procedure to shave down the little bone in between here, because you just don't have a fat pad between the toes. Underneath, yes. Between, no. On the outside, no. No pad. This can be corrected as well with a small bone procedure. Both of them are done on an outpatient basis. But before you go there, check your shoes, pad your toes, space between the toes. If it gets beyond that, come in. Let's get an evaluation and get rid of your toe pain.